Hi, I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined by Dr. Wen Shen. She's a gynecologist here in the Division of Gynecology. Dr. Shen, it's great to have you here.
Thank you. It's great to be here.
To start, can you tell me a little bit about some of the symptoms some of your patients experience after breast cancer?
After breast cancer, depending on the hormonal therapy or chemotherapy that they're receiving, they very often will have hot flashes and night sweats, and most commonly severe vaginal atrophy symptoms, dryness, painful intercourse, as well as bone aches if they're on the aromatase inhibitors. And so those are the most common symptoms that I find in my patients who are breast cancer survivors.
And what type of recommendations do you give patients who may be experiencing some of these side effects?
Right. So most of the patients are estrogen progesterone receptor positive, so they are not candidates for hormone therapy. And for these patients, usually they can achieve some measure of comfort with either Effexor or gabapentin or just lifestyle changes. A lot of them find that they can find some comfort by just dressing in layers and always having a cold bottle of water with them and just adjusting their environment so that they can stay cool and comfortable.
So it sounds like there are lots of tips specifically for hot flashes for patients.
Exactly.
What about sexual side effects? Are there other recommendations you give patients who may be experiencing vaginal dryness or pain with intercourse?
Right. So again, depending on their hormonal status, if they're estrogen receptor positive, obviously we would not be recommending estrogen therapy for them for their vaginal dryness, but there are other non-hormonal vaginal moisturizers as well as vaginal lubricants for them to use. There is a difference between moisturizers and lubricants. So patients have to be very careful about which one they use. They actually need to use both in order to maintain vaginal comfort for regular, everyday comfort, and then the lubricants for intercourse. And also for patients who do have severe atrophy, there's also the option of using physical therapy with vaginal dilators to help maintain the dimensions of the vagina.
Does a patient's GYN health change in regards to screening and surveillance after breast cancer?
No, it does not. As far as breast cancer survivors go, obviously the most important advice that I give to the patients is that they should continue to have regular GYN exams. They should come in for their annual GYN exam, make sure that their uterus and ovaries feel normal, that everything, there's no lesions to be found in the vagina or the vulva. But the recommendations for pap smears are not different for breast cancer survivors. Pap smears and cervical cancer, as we know, are for the most part related to human papillomavirus. And so having had breast cancer is not a risk factor. However, any woman who has abnormal uterine bleeding must absolutely see her gynecologist because they are possibly at risk for uterine cancer because of the estrogen levels, and also for monitoring, make sure they're not developing ovarian cysts or ovarian lesions, especially when they're on tamoxifen.
So for a woman who has her uterus, she should be having a pap smear how often?
If she has no history of abnormal pap smears and she's had a normal pap smear with a negative HPV screening, then she doesn't need one for another 3 to 5 years.
And for a woman who doesn't have a uterus, how often should she be coming in to see you?
If she doesn't have a uterus but she still has her ovaries, she should still be coming in once a year for the pelvic exam to monitor for her ovaries.
But no Pap is necessary, is that
Right.
correct?
And if she has no history of abnormal Pap smears, then, and she's no longer sexually active, then the Pap smears are not necessary. However, if a woman has a history of abnormal Pap smears, of dysplasia, and if she has a new sexual partner, then yes, she would need to have her Pap smear repeated.
You mentioned abnormal bleeding. Are there other warning signs that a patient should come back and see you before their annual exam?
Yes, so for ovarian symptoms, patients who have changes in their bowel habits, pain with bowel movements or with urination, senses of abnormal abdominal bloating, or lower pelvic discomfort. These are all very vague symptoms that could be related to any other number of issues. But because ovarian cancer otherwise doesn't really have any other warning signs, it behooves the patient to be alert to these rather vague symptoms.
You mentioned ovarian cancer. Do you recommend that patients have any type of blood work done to routinely screen for ovarian cancer?
Not as routine, because there are so many other reasons for the patient to have false positive screens. And that would be so unsettling for the patient to think that she may have ovarian cancer when it's not related to the ovary at all. So we don't usually do blood tests for screening for ovarian cancer on a regular basis.
Great. For a patient that's premenopausal who may be sexually active and on tamoxifen, what do you recommend in terms of birth control?
We would recommend, obviously, the non-hormonal options, such as condoms or the non-hormonal IUD, or if a woman is done with her childbearing, she can have her tubes tied, or she can have the E-Shore implanted into her fallopian tubes. So these are all very effective, very good forms of birth control that are not hormonally active.
And one final question. We know with breast cancer patients, their family history may change. Is it helpful for you to know about a patient's family
Absolutely.
history with regards to breast cancer?
Absolutely. That's one of the major parts of my initial intake interview for my GYN and menopausal patients, is to assess their family medical history. And whenever I find the patient who does have increased risk because of her family history, I do refer her for counseling at the breast center, so that if nothing else, she can get education as to what options are available to her and to her children. And this is something that patients are very appreciative of, because this has not been brought to their attention in the past. And definitely, very often patients who first come to me are not completely aware of their family history, and after the initial visit will then go back and find out from her family what specific diseases and cancers the family has had, and we'll go from there.
Dr. Chen, this has been very helpful. Thank you very much for joining us.
Thank you. Thank you very much. It's been a pleasure.